it's a really good question, and unfortunately, I think what we know, the facts are, is that the practice is highly variable, just as you've said, and probably for many of us, it'd be frighteningly variable, meaning that we'd find some cases where we say we feel in our hearts that that was too short. There were probably some where we would say we feel in our hearts that was too long. And we don't really know. I can tell you that the general practice and the way, and we will be reviewing this fairly soon for a new set of guidelines, is that it probably looks like that it's somewhere around at least 40 minutes or so is a reasonable amount of time to at least make a good, aggressive attempt, but that there may be patients for whom it is appropriate to continue beyond that. And I don't know the answer. I think when I see charts, and I see them all the time, where someone got an attempt for 10 minutes, and that happens all the time, that makes me very uncomfortable.
I think I absolutely agree, and I think that there should be standards. But I think, you see, the way that we work in medicine, and I'm sure you guys agree with that, is in general hospitals only really act upon things that are forced upon them from outside regulatory bodies. So Lance Becker, very prominent in this field, writes the guidelines, right? But the reality is guidelines are published through a consensus of international experts, but they're not implemented because nobody goes to the local, nobody goes up to NYU here or Cornell or anywhere else here or elsewhere and says, hey, let me see how long you did your CPR for. Let me see what the quality of your chest compressions were. Let me see how frequently you cool people down. And since somebody collects that data, hospitals aren't obliged to do that. So it's not just how long you do resuscitation for, it's putting all of these things together. And I hope that one day we don't have this potluck chance. You know, the chance of me coming back without brain damage is completely based on the flick of a coin. Who happens to be there, how long they happen to go for, etc.
Yeah, just to highlight exactly what Sam has said, that maybe the more important question that you really wanted to ask is, why is the actual quality of what goes on during the time while they are doing CPR, why is that so different from patient to patient to patient? And we actually know that that's true, and we've published on that. And what we know is that there's high variability in that between the places that actually measure every single chest compression, which is what we do. There's a device to be able to do that. There's ways that you can do that. But most places, despite the strong guideline from the organizations like the American Heart Association, most places simply don't measure it. And you know very well that you just can't sort of fix the things you don't measure in a large system, in a large hospital. Mm-hmm. And so we are big believers. I am a big believer in you've got to measure the things that you want to make better for a person. And there are many aspects of resuscitation that are unmeasured, and those are problems.